Hello, in today's video I'm going to be talking about career path for senior carers in the UK. So last week I talked about how to develop professionally as an overseas nurse. So today is going to be a career path or how to develop professionally if you are a senior carer or care assistant in the UK. The question is, the salary that you get as a care assistant or senior carer, is that enough to sustain you and your family? Is there anything else you can think about? If you want to know more, then watch to the end. Hello everyone, welcome back to my channel. My name is Becky Sechere. I hope you are all keeping very well. So as you heard in the introduction, today's topic is about career path for senior carers in the UK. So most of you from overseas are trying to come to the UK or relocate and work as a senior carer. Some of you may have completed your degrees here on tier 4 visa and switching to tier 2 visa. Others are nurses from overseas who are coming to work as senior carers or healthcare assistants in the UK. The question is, you know, the salary for a healthcare assistant in the UK, it's about £1,300 to £1,400 a month. This depends on where you are living, where you are working, how much you earn, and how many hours you are working in a week. So it is not a set salary. It depends on the hours you work. It depends on how much your hourly pay is. Most people are paid probably around £10 an hour. Some are paid £8 or £9 an hour. So the question is, will that be enough? Is that what you're going to be doing forever? So I'm going to try my best to address or give you information as to some of the things you can do. There are different categories of you. As I said, some of you have finished your degrees, some have finished their postgraduate degrees and wanting to work as senior carers. It is not ideal, but that would do for the time being. But you have to think of the future as to what you want to do. So I've made my notes as usual. So this video, once again, is for senior carers working in the UK or those of you thinking of relocating to UK. My name is Becky Sechere. Remember to subscribe, like and share as well, because I don't want you to keep this video to yourself. So share with your friends as well, because it would benefit them. Okay, so where are we now? When you are working as a senior carer, it does give you the opportunity to do a lot of things. So the experience that you get as a senior carer would open a lot of doors to you. What are some of the doors that would open to you? So one of the options for a senior carer is to look into becoming a nursing associate. Nursing associate, they work closely with nurses, so their grade is higher than a senior carer or care assistant or healthcare assistant. They are trained to do extra responsibilities, or they have more responsibilities as a senior carer, a little bit below the nursing responsibility, however, almost getting there. Nursing associate, they are band 4. Nurses or registered nurses start from band 5, but nursing associates, their band is on band 4. Now, if you want to become a nursing associate, you know, I've talked about senior carer several times. I keep saying senior carer. If you want to become a nursing associate, there is 2-year programs that people do, which will lead to becoming registered as a nursing associate. It is a foundation degree. Whilst you're training, you'll be paid as band 3, and when you qualified, you would be, or when you qualify, you will be paid as band 4. And the training is a combination of academic work and working on the job or learning on the job. Academic work is not for everybody, but there is no one who they've written on their forehead that you can do academic work, you can't do academic work. Anyone, when you put your mind to it, you'll be able to do it, so don't worry about that. Now, how do you apply for this job, or if you want to become a nursing associate, how do you go about it? You have to speak to your employers, or you can go on the NHS jobs website and search for nursing associate training or trainee nursing associate jobs, and you would find some, or you can speak to some universities. Go on university pages and search for nursing associate opportunities and just apply for it. And when you qualify as a nursing associate, you can actually study, top up your qualification, and you can become a nurse. I know, or I have heard of nurses who started as healthcare assistants, get the experience as healthcare assistants, they trained to become nurses, and as time went on, they actually progressed in the ranks. Some are matrons. So there are a lot of opportunities. There are a lot you can gain from becoming a healthcare assistant or care assistant or senior carer. So bear that in mind. So again, as I said, you make that inquiry from your employer, or you search on the NHS jobs. Another one you can go for is nursing apprenticeship. So there are nursing apprenticeship programs as well, and this is only available in England. It's a 4-year program. It would lead to a degree in nursing, and you would be registered as a band 5 nurse when you finish that. Also, they learn on the job, and they do academic studies as well. The pay depends on where you are when you are studying, but you'll be getting some apprenticeship wage. I don't know how much that is, so don't ask me. And if you want to consider or think about that, you can speak to your employers as well, or you can go on the NHS job page and search for nursing apprenticeship programs or nurse apprenticeship course, and you are likely to find it. Or go on some of the university pages and just search on Google, and you would find it. Another option is to think about assistant practitioner courses or associate practitioner courses. So these people are staff who have been trained and have gained skills in a specific clinical area. They work hand in hand with nurses and other healthcare practitioners. It's an 18 to 24 months program. They also, when they finish, they are paid as band 4. And once again, as I said, when you finish at band 4 and you want to train to become a nurse, you can do a top-up courses or degree in order to achieve that. If you're interested in jobs like that, once again, is NHS job site where you can find all these jobs, or you speak to your employers. Now, another option, so there are other people who might not want to train as nurses or do nurse apprenticeships or do nursing associate program or assistant practitioner programs. What else is there? So for those of you who already have degrees or masters and have got experience as healthcare assistant, care assistant, or senior care assistant, there are other options in allied healthcare professional areas that you can consider. So to become an allied health professional, most of it you have to go to university. You need some GCSE qualification, you need some A levels as well, or HND, and different courses have different requirements. So I'm going to be adding links anyway, so you can have a look at those. So one of the allied health professional jobs that you can consider, one is like diagnostic radiographer, to become a diagnostic radiographer. So people who do scanning, it could be CT scanning, ultrasound scanning, and all the other radiological investigators or people who become radiographers. There are different options you can think about. You have to look on the university pages and see what requirements they have. You can think of becoming a paramedic, because if you've got healthcare assistant, care assistant, or senior carer experience, you can train as well. So you can use that experience as a stepping stone to train as a paramedic. But they also go to uni to do paramedic courses, so you have to look at the requirement. These are some of the things that you may not have thought about, but at least this would help you. You can also think about becoming a podiatrist. They look after foot health. Physiotherapist as well is there. Orthoptist is also there. You can train to become a dietitian, but you have to go to university, apply to university to do dietetics course to become a dietitian. There are therapeutic radiographers as well. So therapeutic radiographers are those who help with the treatment of cancer. So they do radiotherapy and designing all sorts of radiological treatment plans for people with different types of cancer. So that would be a very good area as well. So therapeutic radiographer, and we have investigative or diagnostic radiographer jobs as well. There is also operating department practitioner roles you can look into. That also, most of these ones you have to go to university, but having a caring background or being a healthcare assistant or care assistant, if you have the other requirement, if you meet the other requirement, you should be able to go through that. People can go into speech and language therapy courses. Social work is another one as well. It's a degree course. There is a master's course as well, which you can think about, but that it has its own requirements, so you have to look into that as well. You can become occupational therapist as well. So as I said, there are different and loads of specialty areas or allied health courses you can do. You can consider becoming a nurse. You can consider actually going through nursing associate program, nurse apprenticeship program, healthcare practitioner program, after you have got some experience as a senior carer. So it's important for you to think about all these things. You have to plan your life goals. What do you want? If you've got children, how are you going to manage on your senior carer post? So you may have to be thinking of doing something, that would give you a better pay in the future. For now, yes, you can manage with that, but for the future, you need to look at other options. You have to set a goal for yourself. Speak to your employers. If they have these opportunities available, you go for it. If they don't have it, you have to find it yourself. Always look at the description of my videos. I try my best to put links there that would help you to find some of these things. So look at the descriptions. Also, if you go on my YouTube channel page, there is the community section. I do post occasional, I put a few posts there, random occasional posts there. So just keep looking and remember to like and remember to subscribe to my channel and share as well. And if there is anything you would like me to talk about, just put it in a comment section. I might not be able to do it straight away, but I would put it on my to-do list and I would do that for you. If you send messages in a comment and you don't hear from me Monday to Friday straight away, it's because I work Monday to Friday. I work 9 to 5. So very busy, and when I'm free I do these videos. So I check my messages most often in the evening. Sometimes when I'm sitting on the hospital bus going to work, I'm checking these messages and replying to you. So I would not ignore anybody. So thank you all for subscribing. If you haven't done that, do that before you go away. If you've already done that, thank you so much, and I hope to see you soon. Take care of yourselves and have a good week. Bye bye.